All right, so we've completed our sound check, and what I'll do now is give a few seconds, about 3 seconds pause, and then we will begin. All right, good afternoon and welcome to the Wednesday, December 9th, COVID-19 Response Update Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel today. We have Secretary John Wiesman from the Washington State Department of Health. We have Michele Roberts, Acting Assistant Secretary of the Department of Health. We also have Dr. Kathy Lofy, State Health Officer. We have Dr. Kira Mauseth with the Behavioral Health Strike Team at the Department of Health. We have Lacy Fehrenbach, Deputy Secretary of Health for the COVID-19 response. And we have Dr. Charissa Fotinos, Deputy Chief Medical Officer, Healthcare Authority. And with that, we'll begin our panelists, with Secretary Wiesman.
Well, good afternoon, everyone. Thanks for joining us again. So we've reached a moment in our state's COVID-19 response that is both exciting and precarious. Yesterday, Governor Inslee, as I think you know, announced an extension of the current restrictions, which will now be in place until January 4th. Now, we're still seeing very high numbers of new cases each day, and our hospital capacity is stretched, as many, if not most, hospitals are canceling many of their non-urgent surgeries. So we are far from being out of the woods at this point in time. It's also still too early to see the full impact of any gatherings that might have taken place over Thanksgiving holidays. We'll have a much better understanding of what that impact might have been over the next week as we can see more information coming in. Dr. Kathy Lofy is going to do her usual and share more details on the trends we're currently seeing later on the briefing, but it is clear that we do need to stay the course for now. Now, the good news is that while we're all making sacrifices, we are seeing a lot of encouraging developments in terms of our tools to address COVID-19. Within the first week of it becoming available, we saw over 1,250,000 people enroll in WA Notify on their smartphones. That's the new exposure notification technology that we have. And we're increasing our staffing at the state level to support the high demand for case investigation and contact tracing during the current surge. Now, later in the briefing, you're going to hear about a new program that we're launching to connect people who have tested positive or have been exposed to someone with COVID-19 to support them in being able to isolate or quarantine. And every week we have exciting updates on our progress towards the first phase of the COVID-19 vaccination program, which Michele Roberts will update you on. And assuming the necessary approvals are obtained on the Pfizer vaccine, we'll be able to begin vaccinating people sometime next week. So the difficult times we're facing right now will not last forever, and there are many reasons to be hopeful. In the meantime, we must all continue to make the choices that we know will work to slow the transmission, masking up, gathering remotely, and staying at home as much as possible, staying at least 6 feet away from others not in our household, and washing our hands. And that's the consistent message, obviously, you have been hearing from us, and still are the most important things people can do to stay safe. So with that, Frangie, I'll turn it back over to you.
Thank you, Secretary Wiesman. Next, we'll go to Dr. Kathy Lofy. One moment while I make you a presenter. All right, go ahead, Dr. Lofy.
Whoops. Sorry about that. Good afternoon, everyone. Can you hear me, Frangie, and see my screen?
We can, go ahead.
Yep, we can, Kathy.
Great. Well, good afternoon, everybody. I wanted to start this afternoon by showing you a national graph that shows the 7-day average number of cases reported per day here in the United States. And I wanted to show you this because I wanted people to be aware of what happens to the data around, holiday weeks. So you can see in this national graph that cases were increasing rapidly, but then there was a decrease in case counts around the holiday week, and that's generally because a lot of people aren't interested in getting tested if they're mildly ill over a vacation or over a long holiday weekend, and sometimes testing is just not as available on long holiday weekends as well. But what you can see in the national graph is that, despite this little dip, in the following week, the case counts picked right back up again and kind of followed the same original curve that was occurring prior to Thanksgiving. So I wanted to show you that before sharing our graph of case counts, which you all are familiar with at this time. This shows our number of confirmed cases over time. And just wanted to point out that, our COVID-19 case counts do remain extremely high, as John just mentioned. As you can see, we are quite a bit higher than the case counts we had back in the spring and in the summer. Similar to the United States, the U.S. graph, we also are seeing a little dip in our cases around the Thanksgiving week. If you look on the dashboard and look at the actual days of this, this is right when the week of Thanksgiving. But we're not really quite sure what's going to happen at the far right-hand side of the graph. How much higher this particular curve is going to get, whether it's going to get way up here and continue the current graph, or whether it will end up a little bit lower. So we were very closely watching our data to see what happens to this graph in terms of trends post-Thanksgiving, but the bottom line is that our case counts do remain very high. Since we have not shown you test positivity data on our dashboard due to a backlog in getting some of our negative lab results into the dashboard, I did want to show you some data that we received from the federal government. So about 70% of the COVID tests that are performed in Washington get captured in the federal reporting system. Hospitals and commercial labs that are testing people in the state report directly to the federal government, and we can download the data. The blue line represents the daily total tests. It's a 7-day average, and you can see there was a big uptick in testing right before Thanksgiving, and we remember that because a lot of people wanted to go out and get tested, and a number of our test sites were, experiencing really high volumes. Since Thanksgiving, there has been a drop in testing, but it seems fairly close to sort of the trajectory that we were on before the Thanksgiving weekend. And additionally, the week after Thanksgiving, we did see an increase in the positivity of all the tests being performed, which I would call sort of a concerning signal in the data at this point, but we need some more time to sort of understand the trend for percent positivity. The next graph shows patients hospitalized with confirmed COVID infection per hospital admission rate. Leading right up to Thanksgiving, we had a very steep increase in the number of patients being admitted to our hospitals every day. And again, it's a little bit hard to tell now what's going to happen in this region of the graph, since the data in this part of the graph is not yet complete. We're waiting for it to fill in. So I would say that post-Thanksgiving, it's a little bit difficult to know what our trends are going to be, what our trends look like in both cases and hospitalizations at this time. Unfortunately, our COVID-19 deaths are steadily increasing. We know that this graph lags behind our case and our hospitalization graphs and really does not seem to be slowing down at this point, unfortunately. And then the last few graphs I want to show come off of our risk assessment dashboard. They show COVID-19 hospital bed occupancy. And this graph represents bed occupancy for the entire state. And you can see when we were experiencing a very rapid growth in the outbreak in Washington around the end of October and early November, we had a very sharp increase in the number of COVID patients in our hospitals. And you can tell over like the last week or so, this increase has decreased. So hospital bed occupancy remains high and appears to continue to be increasing, but the rate of increase seems to have slowed down. And I think that this is a positive signal in our data. This is the same graph that I just showed you, but it's broken down by different regions within our state. And I just wanted to make the point that COVID-19 hospital bed occupancy is very high, like throughout the whole state. So in the summer, when we were just seeing, a lot of activity in Central Washington, it was a little less concerning because we knew we could move patients from Central Washington out to Spokane or out, over to the Puget Sound area if they ran out of hospital beds. But what's really concerning this time around is that we don't have that, we may not have that ability to do that because hospitals in all of our regions have very high bed occupancy, and many of them have much higher bed occupancy than they've had, since the pandemic started. You can see that most of these areas continue to see increases. I did want to point out South Central Washington. They were a little slower to show increases in bed occupancy this fall, but you can see that they're almost to the number of patients that they had this summer. And this summer, when they had this many patients in their hospital, we did need to transfer some patients out of the Yakima area over to the Seattle area because their hospital couldn't really keep up. And now it looks like the number of COVID patients is getting really pretty close to where they were this summer, which is concerning. And then lastly, I just wanted to show you that COVID-19 ICU bed occupancy also continues to increase. There are now almost 300 confirmed or suspected COVID-19 patients in our ICUs throughout the state. And this is concerning because, when we talk to the hospitals, they are most concerned about their ICU capacity because, particularly because of concerns about shortages in staffing ICUs. So in summary, COVID-19 activity does remain extremely high here in Washington. And unfortunately, we don't have quite enough data yet post-Thanksgiving to really feel confident about the current trajectory that we are on post-Thanksgiving. So that current trajectory is just not 100% clear yet. Hospital bed occupancy is very high, as I just showed you, and is rising, but at a slower rate. So we think that that's a positive signal in the data. As John mentioned, hospitals are continuing to cancel many non-urgent procedures because they need to cancel these procedures so that they have staff that can take care of COVID patients rather than post-operative patients. And so I know we are all really tired at this point in the pandemic. I am as well. But, everything we can do to continue to limit the amount of social interactions in our lives, the better, to help bend this curve. As a reminder, please mask up and keep your distance from others when you're out and about. Stay home as much as you can and really avoid gathering indoors with people who are outside of your household. And with that, I'll turn it back over to you, Franji.
Thank you, Dr. Lofy. And now we'll go to Michele Roberts for the vaccine updates.
Good afternoon, everybody. I'm Michele Roberts, and as you know by now, probably I lead the COVID-19 vaccine planning and distribution team for the Department of Health. And like Dr. Wiesman said, we are in a very exciting time right now. As we've been saying for a few weeks, if everything goes well, we expect first doses of COVID-19 vaccine to be in our state next week. I have some updates on the number of doses we anticipate getting in the month of December. The federal government has given us an estimate of 62,000 doses of Pfizer vaccine for our initial allocation. This is what we expect to receive in the state next week. And we have an updated estimate for them around how many doses of Pfizer vaccine we'll have by the end of December, which is now 222,000 doses. So this represents dose one for people. Remember, the Pfizer vaccine will require 2 doses 3 weeks apart. So that number of 222,000 doses by the end of December is about 20,000 more than we originally thought. Another new detail is that we've been told that we should get about 180,000 doses of the Moderna vaccine by the end of December as well. This is the first estimate we've gotten from the federal government about the Moderna doses. So obviously, both of those doses of vaccines that are coming into the state does depend on FDA authorization. Regular weekly shipments should begin in January, and we do not have estimates yet of the amount of vaccines in those shipments that will be in January or later. Last week, we decided the first sites that will get vaccine next week, which is 17 sites across 13 counties. We'll be making decisions about where the remaining doses of that first allocation will go. We'll make those decisions over the next several days. We want to note, in the early days of vaccine distribution, since we're targeting the vaccine to high-risk workers in healthcare and long-term care, we'll only be showing locations that are getting vaccine by county and the number of doses. As we expand to vaccinating broader groups, we'll make sure that we'll be sharing more details about where vaccine is located. So as more broad groups will be able to get vaccinated, they'll know where they can go to get that vaccine. So here's a little more detail on the timeline we're working with right now. An FDA committee will meet tomorrow, December 10th, to review the emergency use authorization application for the Pfizer vaccine. If the EUA is approved, the vaccine will then be vetted by the Scientific Safety Review Work Group as part of the Western State Pact. That review is happening kind of simultaneously and should take 1 to 2 days. And it will occur while the work will be finalized while the vaccine is being processed and delivered. So it should not cause any delay in getting the vaccine out. A second pharmaceutical company, Moderna, also submitted the EU application, as we had said. So the FDA committee is scheduled to meet on December 17th to discuss and review that application. If they make a decision on the EUA for the Moderna vaccine, then that vaccine would be available the following week here in Washington. Once an EUA is issued, enrolled providers will get special training on the vaccine and additional support for all the clinical information they need to know to be able to administer that vaccine. A few more things I want to say about cold storage vaccine, because I know there's been a lot of questions. So the vaccine candidate made by Pfizer must be stored at ultra cold temperatures. Fortunately, locations that do not have the ultra cold storage capacity can still store this vaccine in a special thermal shipper that the vaccine comes in. This allows additional sites to receive the vaccine as long as they can vaccinate at least 975 people in 20 days. We're also working on a policy that will allow hospitals or other providers who don't expect to use the full 975 doses of the Pfizer vaccine to transfer extra vaccine to other enrolled facilities. This will reduce wasted vaccine. One more final update for today. For provider enrollment, I want to happy to share that we have 189 organizations across the state fully enrolled as COVID vaccine providers. In addition, there are many more applications being reviewed and processed. And so a big thank you to all of the organizations that have enrolled so far. Thank you.
All right, thank you, Michele. Next, we'll go to Dr. Kira Mauseth.
Hi, everybody. Good afternoon. Thanks for joining us. So from a behavioral health perspective, the rest of 2020 and heading into early 2021, we are continuing to experience the disillusionment phase of recovery. And obviously, there's a lot of additional stress related to the third wave of infection rates and the higher hospitalizations that we're seeing around the state. So the risk of suicide and depression and hopelessness, as well as substance use, are historically at their highest during this phase of any disaster. And right now, youth and teens and young adults are really struggling with symptoms of depression, as are older adults, in terms of the lack of connection and some of the isolation that they may be having. So that's a group that we're considering and keeping an eye on. First responders, medical health professionals, behavioral health providers, these are also groups that are feeling emotional impacts as more patients and clients need treatment and support and preventative care. So there are obviously a lot of emotional and mental and behavioral health needs for a lot of us. And sometimes it's hard to find the right resources. But I do want to suggest that everybody has more internal strengths and external resources than we might realize. And that it's truly something that we are resilient and we have the capacity to be resilient in the face of all of these challenges. That's part of what makes humans pretty unique. One of the biggest concerns that we're monitoring, like I mentioned, is that risk of suicide, which is at the highest in this phase and in these winter months specifically. And when we talk about suicide, the first thing to share about that is that it is preventable. So preventing suicide is about recognizing warning signs, and that is something anybody can do. You don't need any special training. It can start by just asking somebody how they're doing, checking in with friends and colleagues and family members of all ages. One thing to look for as a warning sign is a big change in behavior or personality or a dramatic shift of some kind. A lot of times, often when someone's been depressed for a long period of time and then they suddenly start to feel better, that can be a warning sign, and that's something to ask about. If you are concerned about someone you know, it's absolutely okay to ask them about it. Asking about it does not increase risk. It's actually a really helpful thing. Kind of opens the door for people to be comfortable talking about it. So starting that conversation can be as easy as saying, hey, I'm concerned. You don't seem like your usual self. What's going on? And you can ask directly if they're thinking about suicide even, or the intention to harm themselves somehow. That will help keep people safe right now. So if someone tells you that they are thinking about it, one of the things to do is to help remove danger in terms of means that someone might have. So suicides consistently account for approximately 75% of all Washington state firearm-related fatalities. And storing firearms and safely and temporarily removing them from a person at risk or from the home during a crisis can save lives. Everybody can learn to recognize those symptoms, show compassion. We can all check in, just reach out to people and see how they're doing, and seek help for yourself too, if that's what's needed. If somebody tells you that they are at risk, you can connect them to other resources and people who are professionally trained to kind of walk through that process with someone and help them stay safe. It's courageous and it's okay to ask for help and also to check in with others. Talk to a healthcare provider, primary care. If you're a parent and concerned about a teenager or a young person, to talk to a pediatrician for sure. You can also get support by phone or by text. So the Suicide Prevention Lifeline is 800-273-8255. And if you don't want to talk to somebody, but you still want to reach out, you can use text messaging. So that's texting the word HEAL, H-E-A-L, to the crisis line at 741-741. These are services that are available to help you support someone else or to help you directly as well. So I want to encourage everybody to learn more about suicide prevention in these winter months and what's going on right now. Visit the state wellbeing page at coronavirus.wa.gov, which is .wa.gov. And then just keeping in mind that having this information and checking in with people in your families and your communities can help save somebody's life. That's it for me today. Thank you. Back to you, Frangie.
Thank you, Dr. Mauseth. And now we'll go to Lacy Fehrenbach.
Thanks, Frangie. Good afternoon, everyone. I want to update you on a bright spot in our response that we hope can make a difference for the people of Washington. It's called Careconnect Washington. Careconnect is a program for people who have either tested positive for COVID-19 or been exposed and need support in order to stay at home through the duration of their isolation or quarantine. I'm sure you're wondering, how does this work? Local health jurisdictions and their partners are part of the Careconnect Washington network, and they develop a community-based workforce that provides assistance and connects people to local resources that support them in staying home. So what does it do? Careconnect Washington provides crucial support services, things like personal care kits, non-perishable food kits, as well as fresh food orders that are delivered to people's homes so that they are allowed to stay home. Careconnect also helps folks access local resources or services that they may be eligible for, or provide assistance in paying bills such as rent and utilities. Here's how it will roll out in Washington. Careconnect Washington will be introduced on a region-by-region basis. Each region's network connects people to services they're eligible for: medication delivery, healthcare, unemployment support, local housing, food banks, childcare, and more. The regions work with local vendors to supply these goods and services, and this helps contribute to local economic recovery. We started this as a pilot project in Yakima County in July, and we added Benton and Franklin counties at the end of September. To date, we've supported about 2,800 people during their isolation or quarantine period. We now have 2 new regions coming on board and more on the way. The first region covers Clark, Klickitat, and Skamania counties. The second region covers Cowlitz, Wahkiakum, Pacific, Grays Harbor, Mason, Thurston, and Lewis counties. Our goal for Careconnect Washington is to provide a helpful bridge for people in isolation and quarantine so that they can stay home, take care of themselves, protect others, and stop the spread of COVID-19. As the program grows, we'll share more updates about the ways it's helping people from across the state of Washington. I'd also like to share a brief update on where we are with case investigation and contact tracing. As a reminder, local health jurisdictions lead this work, and DOH provides a centralized pool to support local health in our efforts. A few weeks ago, I mentioned that we had activated a surge plan for this work due to the rapidly increasing cases and reports that some local jurisdictions were reaching their capacity. Ultimately, at the state level, we seek to have 700 investigators and have the ability to cover 4,000 cases per day. As of today, we have 374 investigators in our centralized pool at the state level. These are a mix of state employees, National Guard soldiers, and staff who are contracted through our partners at Mathematica. About 200 of these investigators are in training this week, and by Friday, we will have the capacity to investigate up to 1,400 cases per day at the state level. We watch case trends and daily total cases to determine how many additional staff we activate at any given point in time. And as I mentioned, we share this role with local public health. At the state level, in the first week of December, our team was investigating between 250 and 900 cases per day, with an average of 460 per day. Whether it's state or local public health doing this work, high numbers of cases make timely case investigation very challenging. Washingtonians can help us out by answering or returning the call when public health reaches out to them. We really need everyone to participate in case investigation and contact tracing, as it helps us break the chains of transmission and stop the spread of COVID-19. Finally, I'd like to talk about winter holidays. Given the high rates of disease in Washington right now and around the country, our holiday celebrations need to look very different than they have in the past. Many of us discovered very creative, unique ways to celebrate Thanksgiving, and we're asking everyone to do the same as they plan their winter holiday celebrations of Hanukkah, Christmas, Kwanzaa, New Year's, and others. We strongly urge everyone to limit their travel and in-person celebrations, and for in-person celebrations, that those really be only the people in your immediate household. On Monday, the Department of Health published tips for safer winter gatherings and holidays. Some ideas for low-risk activities that we shared include organizing an online holiday get-together or contest, like a cookie contest, holiday karaoke, or a gingerbread house showcase. Hosting a virtual holiday movie watch party, decorating your home or driving around your neighborhood or city to look at holiday lights, mailing cards or letters to loved ones, reaching out and dropping off gifts or treats to family and friends, opting outside for activities like hiking, sledding, or snowshoeing. You can find more tips on safer winter gatherings and holidays at coronavirus.wa.gov/gatherings with an S. We know this is hard. We all miss our loved ones. We all are tired of this pandemic and being unable to be in person with our friends and extended family, especially during this time of year. But the pandemic is still with us. Fortunately, this is not forever. As you heard, vaccines are just around the corner, and our ability for more social activities will increase in the spring. As hard as it is, we must keep up our efforts to protect the people we care about. Death, however, is forever. And so far this year, at least 2,967 Washingtonians have died of COVID-19. These people will never be together with their loved ones again, online or in person. Planning low-risk holiday celebrations and interacting with each other safely now will protect access to our healthcare system for everyone who needs it and save more lives in the weeks to come. Thank you.
All right, thank you, Deputy Secretary Fehrenbach. This brings us to the Q&A portion of today's briefing. We do have a full queue today. So if we do not have time for your questions or are not able to get to them, please reach out to us at doh-pio@doh.wa.gov. All right, to begin, we will start with Hannah from Cairo. Hannah, you're unmuted.
Hi, thank you. I'm wondering, this would probably be for Michele. We're hearing about some reports from people who've had the vaccine already that there's been some adverse reactions, specifically after the second dose. I'm wondering if you can speak at all to those, and then what exactly are we doing to convince people in the state that they don't need to be worried about things like that, the public relations end of it?
Great. Yeah, great question. And what we're hearing about these vaccines and the early information that is available is that they are, which is great, causing a strong immune response. So that is when you have side effects from a vaccine, like it can mimic how you may feel if you were starting to get sick. So maybe you may have some like a sore arm, or maybe just feel a little bit run down. Those are all normal side effects from getting vaccinated. And since these vaccines appear to work so well, we're hearing maybe higher reports of those types of side effects. We'll really know more exactly about how common that is after the FDA reviews these vaccines over the next couple of weeks. And that's exactly the type of information that we'll be sharing with people and with healthcare providers, so they can do that counseling with somebody when they get vaccinated. And people will get this kind of information before they're vaccinated, so they can know what to expect and what may happen. So what may be kind of an anticipated side effect. And then also the CDC is going to be asking everybody who's getting vaccinated to opt in for further information on gathering about what kind of, how you're feeling after getting vaccinated, so we can see if there's any unexpected adverse events or serious reactions to the vaccine. And this is really what we're doing, is we've gathered a lot of information, and we'll know more, like I said, from the next couple of weeks as we hear what data is coming out of these independent reviews from the FDA and at the CDC to answer people's questions and concerns. So we need to first start with healthcare providers, who are going to be the first ones to get this vaccine, sure they understand the benefits and any potential risks from the vaccines, what the side effects are, so they can make an informed decision to get vaccinated themselves, and then they'll be ready to talk with their patients once we're able to start vaccinating more people about that choice to be vaccinated. All of the same type of information is what we have kind of in multiple ways we're going to be sharing with Washingtonians. So both through on our website and through media advertising and with trusted community partners, we want to get this information out far and wide so people can get their questions answered.
All right, thank you. Next question comes from Carolyn with the South Seattle Emerald. Carolyn, you're unmuted.
Awesome, thank you so much. So given that the dose numbers you shared earlier only represent the first dose of the vaccine, only cover a small percentage of the state, how long do you realistically think it will take for everyone to get vaccinated? And then how long do you estimate people will then, associated with that, need to continue to wear masks and socially distance into 2021?
Yeah, great question. So like I said, we actually don't have estimates on how much our regular ongoing allocations will be post January 1st. So that's information still to come from the federal government, but it will take a number of months, if not more, before there'll be enough vaccine for everybody who wants to be vaccinated. So it will be well into the first half of 2021 where we'll still be needing to use all these other strategies to keep us safe. So including wearing masks especially, and some level of social distancing. So that will be a really important part of our ongoing prevention measures. What we can say is that the first group to be vaccinated will be healthcare workers at the highest risk, or workers in healthcare settings at the highest risk, first responders at the highest risk, and residents and staff of long-term care facilities. And we are hoping that we'll have enough vaccine to get through all those groups by into maybe towards the middle of January or a little bit later. And then we can start thinking about and talking about who will be the next group.
All right, thank you. Our next question comes from Carla at AP. Carla, you're unmuted.
Thank you for taking my question. Regarding that possible surge related to Thanksgiving gatherings and travel, I understand you've looked at the data and you're not clear on that yet, but what are contact tracers telling you about cases and clusters? Do you have any examples or numbers about cases traced back to Thanksgiving gatherings? Thank you.
This is Kathy. I can take that. You know, I reached out to our contact tracers this afternoon when I heard this question might be coming in, and haven't received a complete response yet. I do know that there has been at least one outbreak reported to our outbreak unit that was related to Thanksgiving. I also wanted to mention that it often takes several weeks before outbreaks get reported to us. So given that, you know, Thanksgiving was just about 2 weeks ago now, and it takes people time to get sick and the outbreak to be recognized and to be investigated and reported, we don't think that that's really complete data yet. You know, wouldn't really have a way to estimate, you know, if people said that they went to a Thanksgiving gathering and, you know, then subsequently became ill. If we didn't identify other people at that particular gathering that were ill, it would be hard for us to say for sure if transmission occurred at that gathering. So it can be really hard to identify, like we call them sporadic cases that aren't linked to other cases. It can be hard to really understand where a sporadic case gets infected. It's really the outbreaks that we try to kind of hone in on, and hopefully we'll have some more data about potential outbreaks related to Thanksgiving over the next couple weeks.
All right, thank you. Our next question comes from Ariel with the spokesman. Ariel, you're unmuted.
Great, thank you. The governor yesterday in his press conference showed 2 graphs with projected hospitalizations, and I'm hoping Dr. Wiesman or Dr. Lofy could elaborate a bit more on what that timeline could look like, and especially in regards to ICU capacity, which I know is pretty tight right now.
Yeah, that's a good question. So when we met with our modelers earlier this week, they mapped out 2 different projections. I think one thing that's really challenging with where we are at this time with the data is we don't really know what trajectory we're on coming out of Thanksgiving. And I hope that you could appreciate that from a number of the graphs I showed. So there were 2 different scenarios that were presented. One was a scenario that really continued the same trajectory that we were on prior to Thanksgiving. And that showed that, you know, we would have a doubling in total cases in our hospitals over the next 2 to 3 weeks. Which would be a lot for our hospitals. There are about 1,000 patients in our hospitals currently, and I think 300 about in our ICUs. So that would be doubling. And, you know, when we talk to our hospitals, and we're actually doing a survey this week about kind of surge planning and how many additional cases that they could potentially take on. But I would say that many of the hospitals expressed a lot of concern about being able to handle a doubling of COVID patients in their hospitals right now. So we're really hoping that we're not on that trajectory, because that could be very concerning. And I think, we have, I think if you look on our dashboard, there's somewhere around, it says there are 250 ICU beds that are staffed and available. Some of those are in our smaller rural hospitals. If we were to have a doubling in cases and a doubling of ICU patients in the next 2 to 3 weeks, that would take up all of those ICU beds.
All right, thank you. Our next question comes from Anna with KUOW. Anna, go ahead.
Hi there, Anna Boyko-Wyrock, KUOW. Michele, could you confirm Virginia Mason and Swedish in King County and CHI Franciscan in Pierce County are among the hospitals getting the first doses of the Pfizer vaccine?
Like I said earlier, we are not releasing the exact locations where people are going to. I can confirm that there is doses going to both King and Pierce County. Since the vaccine is not available broadly for the general public right now, and hospitals already have a tremendous amount they're managing, we're not going to release the exact locations.
Okay, thank you. Our next question comes from Tom at Public Radio Olympia. Hold for just a second. All right, go ahead, Tom.
Hi, thank you. It looks like from the weekly reports on case investigation and contact tracing from the state DOH and the biggest counties that thousands of newly diagnosed people with COVID-19 have either not been assigned or not been called for a timely initial interview by case investigators in recent weeks. How big of a problem is that right now?
This is Lacy. I can start. So when our case volumes go up, it does become more challenging to reach cases in a timely fashion or reach them at all. We are, as I mentioned, adding resources at the state level. We are aware that locals are adding resources as well in some jurisdictions. In addition, you might recall a couple of weeks ago, we updated that we are streamlining the investigation and contact tracing process so that we can reach more people with the number of resources that we have. I want to emphasize that even when we don't hit our benchmarks for time in terms of reaching a case, we still try to complete the investigation, because if you don't, even if you're too late to stop the first chain of transmission, you can still get the understanding of where people are being exposed and potentially trace forward to intervene in future or a second or third generation of transmission. So we are working to improve those performance metrics so that we are reaching people more quickly and being more effective at stopping the spread. But we do feel strain on our system when the case counts get this high.
And I'll say too that on some of those, we're reaching them, after the first day. We have the goal of trying to reach them in the first day, and we continue reaching out to them. Sometimes it is a reporting delay in our system. So as Lacy said, we're adding the resources and staffing and really asking people to return our calls when we get messages or leave messages. Because that's also part of the challenge many times is, and I understand it, I often don't answer a phone call I don't know, but if you get a message, it would be great to return that call.
I think another thing that I'd quickly add is really re-emphasizing the Secretary's message early on for WA Notify. This is a supplement to contact tracing, and it allows a person who is a case that uses WA Notify to very quickly notify their close contacts who also use WA Notify, so that they can anonymously learn how to protect themselves and others through quarantine, getting tested, and monitoring for symptoms.
All right, thank you. Our next question comes from Simone with Q13. Simone, go ahead.
Thank you. I have a quick follow-up for Lacy, if possible, and then my actual question that I wanted to ask. Do we know the state's contact success rate at this point? How many people are they able to reach that they're trying to within the first week or so? And then my question originally is, did Washington State at all have to adjust their shipment expectations to lower them for the vaccine? We're hearing that some states have had to lower their expectations as we've gotten to the end of the year. And then is there any concern about being able to get those second doses into the people that have those first doses when we don't have any estimates related to January shipments? Thank you.
I can start. We do post a report regularly that shows how we're doing on case investigation contact tracing, so we can get you a link to that and follow up. I can also share, because I shared a little bit of data from the number of cases we were investigating in early December. Among those days, December 1st through December 7th, we have completed between 52 and 95% of the interviews assigned to us. And then I'll let Michele take the vaccine question.
Yeah, so could you repeat the first part of your question again? I know the second part was about second doses.
Michele, it was if we had to adjust any of our measures.
Thank you.
Yeah.
Thank you, John. Okay. Yeah, there was some reports this week about, or in the last week or so, about how the Pfizer vaccine allocations were adjusted down, and we've not had to make any further adjustments. That is why we were waiting to release those final numbers until we had that final information from the federal government, because it was changing frequently, and that last piece of information was that the numbers did adjust down, which is reflected in the numbers we have shared. As far as getting the second doses, the federal government is, as far as we understanding for the plans, they are actually planning on, for the supply they have, holding enough vaccine for all the second doses. So that will be in addition to our allocations we're getting. So the second doses will be matched to the providers who got the first round of doses within 2 to 3 weeks after that first dose. We'll get enough to make sure those same providers can give a second dose. So I think that is handled on the back end.
All right, thank you. Our next question comes from Tammy at Como. Tammy, you are unmuted.
Hi, good afternoon. Thank you so much for your time. My question was for Dr. Lofy, actually. Dr. Lofy, when we're looking at the cases per 100,000 people in just like the state of like different counties, especially like King County, Snohomish, Pierce County, Yakima County, I mean, we're talking about like 400 cases per 100,000 people when the goal should be 25 cases per 100,000 people. That seems a little bit, not even a little bit, very overwhelming. What is it going to take for us to get those numbers down, especially to considering that hospitalizations are going up, ICU beds are filling up?
Yeah, no, thanks for that question. So yes, as you noticed, our case counts and our rates are extremely high right now, much, much higher than they've been throughout this entire pandemic, as you saw on the initial epi curve. So, I mean, in terms of what we can do, it really just comes down to all of the public health messages that we've been talking about all along. And really trying to do everything we can to stay physically distanced from folks that we interact with who are not from our household. make sure that we're always wearing a mask when we are interacting with people outside of our household, and to really do as much as we can to really stay out of indoor spaces, particularly ones that have poor ventilation. This doesn't mean that you can't, socialize with your friends and your family. We think people can safely, socialize in small groups outside if they're physically distanced and wearing a mask. We know social interactions are incredibly important. The other thing that's really important that I want to stress is that we continue to see a large number of outbreaks in workplace settings. So it's really important that people don't let down their guard when they're at work. We've heard lots and lots of stories about people who, wear their masks, throughout most of their workday, but then go in the break room and take their masks off and, sit within 6 feet of a coworker, and then that subsequently results in spread. So unfortunately, this virus likes to take advantage of us anytime we do let our guard down. So we really need to think about really all aspects of our life. Making sure that we are wearing those masks, staying physically distanced, and limiting the time that we're spending indoors with people outside of our household.
All right, thank you. Our next question comes from Rachel with the AP. Rachel, you are unmuted.
Hi, are there any details you can offer on the end-to-end vaccine distribution to the states? Were there any problems that caused concern for next week's official shipments?
Yeah, great question. So last week, all of, or at least many of the states got to participate in an end-to-end practice shipment with the Pfizer vaccine and really test out how that process would work. So that started from our staff placing the vaccine order at the Department of Health, which went to the CDC system, and they had to review and approve the order and then get that information to Pfizer for shipping of the vaccine. Well, in this case, it was just the shipping container, giving a chance for Pfizer to check out the temperature monitoring device they have in the shipping container and other aspects. And then it went to one of the local health jurisdictions here in Washington. So overall, everything went very smoothly. There were just a couple minor hiccups here for our state, and they were pretty minimal about like one of the notifications about that was supposed to happen about the status of where the shipment was from Pfizer to the end user. One of those didn't happen, but other notifications happened. So it was pretty minor for our experience here in Washington State and gave us hope that all of this is going to go pretty smoothly.
All right, thank you. Our next question comes from Evan with the Seattle Times. Evan, you're unmuted.
Hi, thanks for the time. Michele, I was hoping you could go into a little bit more detail about the concern that warrants not telling the public, who as taxpayers are paying for the vaccine, the first sites where the vaccine is going. Have there been threats? Is it for security, something else? Can you elaborate on that reasoning?
Yeah, there definitely is just security concerns, and there is so much interest on where this vaccine is going, and really just helping manage the pressure around that, helping make sure we're getting those doses to the right people. And yes, it is that this vaccine is a taxpayer asset, which is exactly where we're going to be sure to make sure everybody understands how many locations and how many doses are coming into the state.
All right, thank you. Our next question comes from Sarah at The Olympian. Sarah, you are unmuted.
Thank you. I have two questions. One is just clarifying. So we have these three numbers. It's 62,000 doses of Pfizer vaccine initially, 222,000 by the end of December, and then 180,000 of Moderna by the end of December. These are all estimates, I understand. But the first clarifying is, so 222,000, is that total including the 62,000?
Yes, that does include the 62,000.
Okay, and these are all first doses. So those will all be represent one person per dose there.
Yeah, so that would be that. So those numbers are about 400,000 doses of vaccine between the two products if they both receive FDA authorization. So that means that by the end of December in our state, there'll be enough doses in the state to vaccinate with, for the first dose, about 400,000 people.
All right, thank you. Our next question comes from Ashley at KNKX. One moment. Go ahead, Ashley.
Oh, hi. This is a question for Michele. You might have repeated this, but it's possible I missed it. Could you just go over the numbers of the vaccines that we're expecting this month, both the Pfizer and Moderna? And then you said by, I think, mid-January, you're expecting healthcare and first responders to be vaccinated. Was that just high-risk healthcare workers and first responders? Okay.
It's a great question. Yeah, the estimate for mid-January, and there's a lot of details still to come on that, but so that's just a rough estimate. So that would be to get through this first group of kind of what we call the 1A, the first group of people eligible for vaccine. So that is workers, the highest risk workers in healthcare settings, and we're really defining that by people who are either working with or treating people who either have COVID disease or are suspected of having COVID disease. And we're providing additional guidance to healthcare providers to help them on that. And the same thing for first responders, either people who are help providing care to either people who have COVID or are suspected of having COVID, along with all the staff and residents of different types of long-term care facilities. So we expect that we'll have enough doses into January to vaccinate that whole group. Like I said, we don't have firm estimates or any estimates after January, but we know vaccine will continue to come on a weekly basis. And one piece of information we don't have great information on is really we're going to have to learn a lot about what vaccine uptake will look like. And what I mean by that is how many people would choose to get vaccinated. You know, we've all seen a lot of public opinion polls on that. I think we're really going to have to see what happens after vaccine is here and people have who are eligible to get the vaccine have a real choice to make and looking at the benefits and what we know about potential risks from the vaccine and make a decision about what they want to be vaccinated. And so how many people will choose that, which will also influence how quickly we move to the next phases, because we don't want to leave vaccine sitting on shelves. So that's kind of what's happening with our plans going forward. What I can say, I'm going to repeat the number of doses here. So for the total in December for the Pfizer vaccine, the updated estimate from the federal government is a little higher than the number I had shared previously, and that's now 222,000 doses. And that amount for Pfizer does include that first shipment next week of about 62,000 doses. So that's how much Pfizer vaccine we expect to have in the state by the end of December. And for the Moderna vaccine, our estimate from the federal government is about 180,000 doses of the Moderna vaccine will be available in Washington by the end of December.
All right, thank you. Our next question comes from Scott with the Seattle Times. Go ahead, Scott.
Thank you. I'm wondering about homeless folks and where they're going to be at this point on the priority list. Where do homeless shelters fall, for instance, in relation to nursing homes? And where do outdoor homeless camps fall on the priority list and outreach to them? And if you know, like out of the roughly 22,000 homeless folks in Washington, how many are you hoping will take both doses of the vaccine in 2021, if you have any sort of goals for that right now?
Yeah, we don't have any estimates of how many of people who are experiencing homelessness what their estimates for taking up the vaccine will be. So we'll have a lot more to learn as we work through this process. We're also still working on decisions and about who will be next to get vaccine after we work through the full 1A group. And a lot of that is that we still have been gathering information from the community to help inform those decisions. And we've talked about that more, but some of the surveys and some of the community interviews we were doing. But also, we really need to hear what the federal recommendations will be from the CDC Advisory Committee on Immunization Practices, because they've not made recommendations on the 1B or 1C groups. So we expect other people, like people experiencing living in homelessness or other types of congregate living settings, will be part of those next groups who will be eligible in later phases of kind of the phase 1 of vaccination, but we don't have exact timelines yet.
All right, thank you. And with that, I want to close by thanking our panelists for their time today. And also a special thanks to tvw.org for hosting today's live stream and past archives of these briefings. And this concludes today's media availability. If you need to follow up, reach out to us at doh-pio@doh.wa.gov. Thank you.